Hey everyone, welcome back to another session. Today we have Dr. Sable, and we're super excited to have you and thankful. So whenever you're ready, you can start.
Awesome. Hi, everybody. Hope you all can hear me, and super excited to be on this today. Thank you so much for the opportunity. I absolutely love helping pre-dental students, and so I am excited to share with you some of my cases, my background, and please ask as many questions as you want. I'm here to answer them, and let's get started. So disclaimer, I have no financial affiliations with any of the products and companies presented. So that's that. So I'm sure you're wondering if you've never met me before, who I am. So I'm actually from California. I went to USC, home of the Trojan family, fight on. And I was there a couple of years ago. Just found out it was a 10-year anniversary since I graduated. So yay. I'm turning 32 next week, so that's super exciting. I was just telling the girls earlier, I'm either turning 23 or 29 for another anniversary of that. So most of my patients actually think I'm 23. That's usually the guess that I get. So it works. So again, from California, and I ended up moving to Florida. So I'll tell you a little bit about that. But my father is a dentist. This is when he graduated from dental school. He went to USC for their international program, was the first Romanian to graduate from it. So super proud of him for that. My whole family's from Romania. I'm first generation here. And then on the right, you see when I graduated. So in case you didn't know, lilac is the color of dentistry. So that's why whenever you see someone graduate, that's where that pretty purple color comes from. So just a little tidbit, if you're on an interview to dental school, maybe wear a little bit of lilac in your outfit, whether it's a tie, whether it's a shirt, something, and it'll make you look cool. So when I moved to Florida, I went there for dental school, like I said, to LECOM. And this is what my school looked like every single day, except around 3 o'clock when a big storm would come in. And then it would die out in 15 minutes, give me a nice car wash, and I'd be on my merry way. So I absolutely loved going to LECOM. I did anything and everything I possibly could while I was there, took advantage of every opportunity that the school had to offer. So if you look at the school, I'm hoping if someone could give me a nod if they can see my mouse, maybe. Okay, cool. So so this front part of the school is where you would take classes. So there were some lecture halls up, or there are lecture halls up top. Then you have your PBL classrooms over here, which PBL stands for problem-based learning. And so that is, you have like two ways of learning in dental school, depending on where you go. There's lecture-based, and then there's the problem-based learning. And so PBL is more for like, you get cases, and it's like that TV show House, where they kind of give you a little bit of information at a time. And then you have to do your research, understand what that is, and figure out, is this what my patient is experiencing? And so a lot of the board questions are like that as well. So that works to your advantage when you're studying for boards. But our school was a hybrid type of environment. So we had PBL for certain classes, and then we also had lectures for other ones. And I personally liked that. There's a lot of self-study, but as long as you're motivated, you'll be good to go. But it also really allows for a nice team environment with the rest of your classmates. So, not everyone is, competing so much with each other, because you all have to help each other in these cases. And usually they're groups of 6 to 8, from what I recall from back in the day. And they purposefully make the groups a certain way. So like maybe there's someone who did a master's in chemistry and someone who has, an engineering background, stuff like that, so that you all can mesh together and learn from one another. So on the other side, we had our cafe And so that was really nice. Everything was under $5. They really, took care of us to make sure we were well fed. We had this beautiful lake over here where we had a gator. We called him Kilgore. Kilgore is the name of not because of killing, but it's the name of a dental company. And I think there's like 3 gators in there now. So I would always check underneath my car before I left to make sure I didn't have any visitors. But hey, that's Florida. The saying is that there's a gator in every single lake in Florida. So I don't know about all that, but yeah. And then the other half of the school is the clinic. And so there's like a set of doors between them. So unless you have a key card, you can't get through. So that's nice. You never worry about the patients coming on the side where the lectures and all of that are. So the clinic, there's 10 different clinics. Each pod has 10 operatories in it. And each operatory, you have your own chair. So you're never really like fighting for chairs or anything like that. And each pod has an x-ray machine, it has a wet lab, and it's literally run like a little office. You have a patient care coordinator that checks in the patients, deals with the money, all of that stuff. So it really gives you a feel for the office. And then also because you have a wet lab, not only is that helpful for your lab work, but also you're responsible for your own sterilization. And so it really, really helps you like know from A to Z how to run an office. This is my mentor, Dr. David Rice. He started something called Ignite DDS, which I'm sure you may have already heard of, or if you haven't, go look it up. We have something really awesome called Ignite DDS University now, and which is a lot of continuing education courses to help you. And even as a pre-dental student, I would highly recommend becoming a part of that and learning as much as you can. And feel free to call me and ask me questions if you don't understand something. But I met Dr. Rice my first year of dental school. And I went to UF. They had a business symposium. It was a Saturday. It was pouring rain. It was like a 3-4 hour drive. And I showed up and I heard him speak for 20 minutes and I like just fell in love. And I was like, this is the person that I want to be. And I went up to him afterwards and I'm like, hey, like I'm almost as tall as you. I'm wearing heels in that picture. But I'm almost as tall as you. Like, can I be your little mini me? Like, and we're both very tall people. And he was like, okay. And so we just kind of started talking and he came and spoke at LECOM. And then we went out to breakfast and we ended up starting up something called Ignite Predent, where that's given me the opportunity to help a lot of you guys and help you with your personal statements, interviews. I've traveled around the country and gotten to speak and at a bunch of different pre-dental programs and pre-dental days and whatnot. And I've always wanted to be there for people and help all of you fulfill your dreams. And you'll understand why in a little bit. But I'm very thankful to him for giving me all those opportunities and always putting me in the best light. And so my advice to you through that is make sure that you always show up. Like you don't know where you're going to meet someone that could change your life. And I could promise you that David Rice changed my life for the better and gave me a lot of opportunities that I never would have had if it wasn't for him. So always remember that no matter how tired you are or whatever, like just because you got into dental school doesn't mean it just stops. So while I was in dental school, I was president of ASDA, the American Student Dental Association. So that's like the baby of the ADA, and which I am a part of now. And by being president, I also had the honor of being the first consultant for the Florida Dental Association. So that really helped me get into organized dentistry. It helped me understand the myriad of ways that dental school that being a dentist can work. You don't have to be with a patient all the time to be a dentist. There's so many ways to apply dentistry, whether you're teaching as a professor, whether you're doing research, whether you're in organized dentistry. Like, that's the awesome thing about dentistry, because just with that degree, you can do so many things. So I've gotten to meet so many people through all of that, and would highly recommend that you become a part of it when you join dental school. This was at one of the conferences. Every year there's ASDA annual session. This one was in Texas, in Dallas. And so that was also cool. You get to go on different trips and stuff like that. Here, I actually represented all of the dental students and dentists in Florida at a hearing that was against something called dental therapists. So for those of you who don't know what dental therapists are, basically, they are people who can go, they take 3 years of school, just need a high school diploma. You do this 3 years of school, and you can do simple extractions, which you will learn is never guaranteed. You can work on patients when it comes to cleanings. I think you do certain fillings, do a lot of things that a dentist does, but you don't have to take a DAT. You don't have to go pay 500, well, whatever, $250 to $500,000 for your education. And a lot of patients don't know the difference. They don't know that you're not an actual doctor, and you are literally, in my opinion, putting patients at risk, because if you don't know how to manage certain situations, good luck. And like I said, you don't need even a college education to do it. So we were fighting against this. And with I wanted to use the funds for dental therapists that the company that was trying to vie for it. I wanted them to take those funds and use them towards a scholarship program or some sort of loan repayment program for dental students and new dentists, because the whole reason for dental therapists was so that they can serve in underserved communities. And the problem, dentists don't want to go into, even though they may want to go into underserved communities, it's hard to, because with loans that are $500,000, you can't really do that. And so with the dental therapists, that was their point. But they had tried this out actually in Minnesota for a number of years. And there were 46 dental therapists, and 43 of them were in areas like Twin Cities and Minneapolis. Those are not underserved areas, okay? Like, all of us know about those places. So definitely not working. So that's just something that, if you want to read up on, it could be something good for you to bring up in an interview if, somebody asks you about current events or something like that. I was also able to do research in dental school, and I published it in Compendium, which is a really big dental journal. And it was about dental implants. And so it didn't have to do with me, sitting behind a lab bench every single day. So that's the awesome thing that I learned. It was more of a market research and something that you can do even as pre-dental students. When I graduated not only with my DMD degree, but I also graduated with a master's. So I did a master's at the same time as dental school. So when I say that, like, I milked LECOM for what it was worth, I milked LECOM for what it was worth. I took advantage of every single opportunity, and I was very thankful that they let me. And I'm very thankful that I was, able to accomplish everything that I have. And so one thing I wanted to bring up is, because it's a quiz question later, is DMD versus DDS. So a lot of people have that question of, like, is there a difference between the two? Is one better than the other? Basically, from my research, Harvard started a DMD degree, And it just became more of like more East Coast schools tend to do DMD and more West Coast schools tend to do DDS. There's absolutely no difference between the two. You're still the same exact type of doctor. It's not like DO versus MD, but I personally am a DMD, but the like interesting thing is, for instance, I got my license in California as well. And part of like, I had to take a law exam, and part of it was they said, as even though I'm DMD, if I were to market myself in California, I would say my name is Sable Muntean DDS, because that's just what California is. So literally, like I'm saying, no difference whatsoever. It's just more of an East Coast, West Coast, Midwest thing. Okay. My dad was able to hood me at my graduation, so that's something that you guys can look forward to. It was a big, big, big honor to have him. And so hopefully, if you guys have someone like that in your family who's a doctor, they'll be able to do that for you. My mom, she organized a big party, and it was also my 29th. That was the first anniversary of my 29th birthday. And she had ordered and designed this like beautiful cake. And that was just a great time for graduating and my birthday and whatnot. And after graduation in 2018, I started a AEGD, which is it stands for Advanced Education in General Dentistry. And I started that program. I would highly suggest, whenever you guys are done with dental school, that you do an AEGD or a GPR. So an AEGD is more clinic based, as opposed to a GPR, which stands for general practice residency, is more hospital based. So usually in a GPR, you're going to be on call in a hospital. You're going to have to deal with emergency room situations, more medically complex people, that kind of thing, as opposed to in the AEGD, it's more you're in a clinic, or you might be still in a school, something like that, or a VA. And that's how you're going to get your patients. So I did, like I said, an AEGD at SIU. And this is currently where I live. I live in Illinois, but I practice in St. Louis, Missouri. It's like a 35-minute drive from where I live to where I practice. And after I did all that, I did an implant fellowship because I just can't seem to stop. And so the AGD was a year, and then the implant fellowship was a year. So that was a big honor to get to do that. And I really struggled between trying to figure out, did I want to specialize, or did I want to go to do just stay a general dentist. And I realized, for me, I didn't want to necessarily be the end all be all. I mean, who knows? I could change my mind again. I change my mind a lot. But I didn't want to be the end all be all where I can't refer to anybody else. Like, and now, like, being a general dentist, like, it is so nice to know if there's something that looks just too hard, or if the patient is too like their behavior isn't able to be controlled or something like that, that I can just be like, hey, here's the specialist. Like, have fun, good luck. Last night I was at a dental meeting, and I finally met, because of COVID, I never really met anybody. And I met some of the oral surgeons that I referred to, and I was like, sorry. It's not, sorry for giving you the not so fun patients. And because I really like doing extractions, so I really like hold on to as many as I can and do them myself. And so whenever I do refer out, it's not for a good reason. It's more of, oh my gosh, this patient is very difficult, or the tooth's just very difficult to take out. And so yeah, and they're like, it's okay, like, we know, but it sucks that we can't refer to anybody. So that's one of the reasons I didn't want to do a specialty. And another one was just, I love too many things about general dentistry to give them up. And I don't really like one particular specialty enough to want to give everything else up for. So all I will tell you through that is be open-minded, and you will, um, you might change your mind multiple times as well. You might think right now you want to be a specialist in something, and you're going to experience something in dental school that might change that for you. So just be open-minded. And this was in the fellowship during COVID. I'm the one in the back on the right. So during COVID, the five of us, that's our director on the left, but the five of us, there was me and the girl, we were both in the implant fellowship, and then the three guys were in the AEGD, and we all took care of seeing all the patients for the school for 3, 4 months. And so not a fun time. But all of their emergencies we took care of, and then they opened it up to patients not of record. So very busy time for us. But hey, COVID. Um, and this is currently where I work right now, University Dental Care, and I'll show you a little picture in a second. But this is where I am right now. I came over here. I'm in my office. It's my day off, but I needed somewhere with Wi-Fi, and I was in the St. Louis area, and I didn't want to drive back home, so I'm like, going to the office. So I know I told you a whole lot about me, just to kind of get to help you know who I am, but there was a reason that I said everything. And basically, I wanted you guys to maybe find something that you might relate to, whether maybe you're Romanian, or maybe you have a parent or someone who is in the dental field, or you like research or stuff like that. So maybe there's something we have in common, because um, I think that really helps when trying to get into dental school, because, like I have written right here, one day you will thank yourself for never giving up. The reason I wrote this is because I applied to dental school 4 times. So you look at me, you look at all of my accomplishments, which I'm very proud of and humbled by, but nothing ever came easy. It was very difficult for me to get to where I have been and where I am today. And when I, worked my behind off in dental school to accomplish all of the things that I have, I, did that because I was just so excited and so thankful to have that opportunity, because I applied 4 times to get in. I did not give up. And if you really, really want to commit to this career, you don't have to give up. Okay. Don't let anyone ever tell you that you're not good enough, or that um, something's wrong with you, or you're never going to amount to becoming a doctor, because at the end of the day, my patients don't care. Do my patients ask me, like, how many times did you apply to dental school? No. Do they ask me where I went to school? No. They like, and yeah, it doesn't matter. Okay. And so really, really be mature in your decisions, and know that whatever you decide to do, whether you continue to apply to dental school if you didn't get in the first or the second time, or whether you decide to not, just be at peace with your decision, and know that, like, if you do really want it, you will get to it. I promise. Somehow or another, if you're good enough, and um, uh, of knowing, recognizing where your faults are and improving on those, then you'll be solid. Okay. So let's get into some more fun stuff. This is me in front of the office. It was snowing, but this was the day that they put my name up on the sign. I was really excited. But yeah. So why dentistry? This is a question you're going to get a lot of times in interviews and whatnot. And why did I choose it? So yes, my father's a dentist. Yes, my mom she's the office manager, and so, at the office, so they work together, drive separately, because at 6 o'clock, my mom's like, "Bye," and then my dad is like, "Oh, let me sit and do, this, and this," and now I understand why I'm at the office all the time because I'm just like my dad in that regard. And so, yes, no matter what, I mean, my parents were very supportive in my decisions, and they always said that they wanted me to become a professional where I didn't have to rely on anybody else and I could be independent. But they never told me I had to go into dentistry. But my entire life, 32 years almost, I have never heard my dad say, "Ugh, I have to go to work tomorrow." My dad absolutely loves being a dentist, and he just left the door open for me, and I was just like, "Okay, like, I like this. Let me explore it more," and that's how I got into it. So, no, I did not become a dentist because my dad's a dentist. I, fell in love with dentistry because my dad loves it so much. Um, I also love the fact that I can change someone's confidence in themselves in even just 10 minutes. So this was a patient during my 4th year of dental school who was 10 years old at the time. And he had chipped his tooth. His friends used to call him Chip. He hated it. He was really sad. And his other tooth that you see on the right, that one had a big cavity in it that was starting up. So that's why that one is cleaned out. But as you can see, he fixed his tooth and he was so happy. Like his grandparents even called me, like saying how ecstatic they were about, how happy he is and what a change they've seen in him. And like I just had another patient who I fixed all of her front teeth, and all of a sudden I started noticing she's been losing weight. She changed her hair, makes it all fancy now, wears lipstick and like does her makeup, and she wasn't doing that before. And so it's just awesome to see like what an impact you can make on someone's life in not that many appointments. And then this little lady on the right is the whole reason that I became or decided to go into implants and whatnot. And I still talk to her to this day, and I still talk to the boy's family as well. But she, at that time, was 79 years old and rheumatoid arthritis, wheelchair bound. The professors at school were kind of hesitant in letting me, like, work on her because basically she was in terminal dentition. Her teeth no more could be saved. Because of the arthritis, she couldn't brush them well. And it was just like, okay, well, taking out all of your teeth and doing dentures is the way to go. So she was really the first case where I took out a number of teeth, and that's when I saw like how much I love oral surgery. And so like I said, she's the reason that I've kind of gone more of that surgical route and am doing the implants and whatnot. And I just absolutely love how her smile turned out, even though there's no implants involved in there, it's just dentures, but still, I got that opportunity to take out her teeth and whatnot. And she was a little trooper and still is. Um, where was I going with this? I don't remember. There's the schools. I don't know. Just there you go. LECOM's over there. SIU's over there. But oh, I remember now. I think I moved the slide in the wrong place. If you guys have any questions about the schools in particular, and I know this presentation is more on dental shadowing, but still, like, I'm more than happy to answer those questions, and or just dental school in particular of, where should I apply to? How should I choose the right dental school? More than happy to help you out with that. LECOM was awesome because there were no dental specialties, so you really got to do all of the work, and you never had to give it to one of the residents. Also, our first 3 years were in Bradenton, and the last year was half the class went to Defuniak Springs, Florida, which is in the Panhandle, and the other half went to Erie, Pennsylvania. And so by doing in those two places, we were able to separate ourselves from the third years. And so you were never like in a competition, of like, oh my God, I need to like finish my requirements and the third year has to give it up to the fourth year or stuff like that. Which you will find happens quite often in schools. Always, I finished my requirements February or March of each year. So, just some of the perks of LECOM. And SIU, there's something else. So LECOM, I really liked because it was a new school. So I was the third graduating class. I think they're on their like seventh, fifth, sixth, something like that now. But you might be hesitant of like choosing a newer school, but don't be, because like I really liked LECOM because they were very open to hearing what students had to say and improving upon that. Not anything wrong with other schools that are more set in their ways, but there's pros to that too, in that they do have enough experience and they do see what works best for their students. And so, somewhere like SIU that's been around for many, many years, they're very good at doing that. I mean, their students do very well on their boards and whatnot. So just a lot of things to think about when it comes to choosing a dental school. And just make the right choice for you. Just get in, okay? Don't worry about what anyone else thinks. Don't worry about like, oh, are my parents going to be mad at me if I move far away or whatever. You just need to get into one dental school. Like, doesn't matter. And it's very difficult to get into dental school these days. And I would just say, just get in somewhere. No matter what, you're going to have that DMD or DDS behind your name. And then you can do whatever the heck you want and practice wherever you want, make those decisions, and enjoy your life. So here are some cases, okay? So dentistry for general dentistry, there's a bunch of things that you can do. You literally can do everything except that you're held to the standard of care that a specialist would be. So if you're wanting to place implants and an oral surgeon or a periodontist could have done it better, then that's where you can get into trouble. Okay. So this is just your regular filling. So this is your bread and butter dentistry. This was a kid that came into the clinic for my residency and had a lot of little cavities, and it's fun building the teeth up and trying to make that anatomy all over again. And always take a picture before you start adjusting because you put in all this pretty anatomy and then you start adjusting and then it doesn't turn out as pretty anymore. So if you ever want to take a picture of your work, that's my 2 cents to you. You get some really cool extractions. So this was a patient that I had that I extracted his wisdom teeth, and crazy curves that you would have never seen, especially with the number 16, that's the top one over there, that upper wisdom tooth. You can't tell in that x-ray that tooth is going to look the way that it did. So very thankful that tooth didn't break off. And then number 17, you can see just exactly now in the x-ray just what it looks like. So lots of little tips and tricks that you have to do when you extract to make sure that you don't break things, or try not to at least. This was a patient that I had in dental school who that's his before and after pictures, and he still keep in touch with him to this day, but he pretty much needed every single tooth extracted, and I actually did 4 frenectomies on him before I even did a cleaning on a patient. So that was really cool that I got to do that surgical part for him. But and then I made those dentures. So frenectomy, so that's basically you have your frenum, which is that tissue that's between like here and here, your tooth and your your gums rather, and your lip. And so if those frenums lie too far down on the ridge where the denture would seat, you have to cut them because you're just going to constantly push that denture out anytime that you move your lips. So in his situation, that's what happened. And so we had to do those frenectomies before we could take care of everything and start building those dentures. And yeah, that's that one. This was a really cool extraction I did by mistake. Not sort of. Okay, let me back up a second. So this is something called concrescence, which, pay attention, is another one of your quiz questions. So concrescence is when the cementum is fused. Okay, so you can see how it's wider over here. This is the crown of the tooth. That's your enamel. Okay, underneath your enamel is dentin. So dentin is the more yellowy substance that holds all the endings that have the sensitivity. And so when someone wears down their enamel, their teeth become more sensitive because you're exposing that dentin. Well, now over here, you see there's a line right here, and that's called your CEJ, your cemento-enamel junction. So that's where the cementum, which is this part of the tooth, meets the enamel. So when the cementum is fused with another tooth, that's called concrescence. Okay. So with this patient, I was extracting number 15, which was his upper left molar. And when I looked at the x-ray, nothing looked abnormal, except that the tooth needed to come out because it was too far for a root canal. And when I elevated it out, everything was very smooth. Everything worked out perfectly. I go to pull the tooth out and I start pulling out something that looks a lot bigger than just that one tooth. And all the way in the back of the mouth, you have something called a tuberosity, which is like a area of bone. And you pray that you never break that tuberosity when you're taking out a maxillary tooth. And I was like, oh my God, I totally broke this like old man's tuberosity. And if he ever needs a denture, he's screwed because it's not going to sit properly. And this just sucks. And so I start like sweating bullets and I like go to put the forceps down. And when I look, I'm like, man, that looks a lot like a crown of another tooth. Well, his wisdom tooth was still up there, and that's what was fused with number 15. So when I pulled him out, I pulled him out together. So I just told him it was right after Labor Day. So I told him it was a Labor Day special of 2 for 1, and I wasn't going to charge him. So that was that. But hey, really cool. Actually, creepily still have that tooth. But yeah, yeah, never know. But you get to do a lot of extractions, which are very interesting. So this guy, we put him in upper and lower dentures afterwards, but all of his teeth were shot, and I just, had to take out all of that infection, level out the bone, take out each one of those teeth. You can see some came out easier than the other ones, but he was terminal dentition. That's after I sutured him all up. Now I've learned some better techniques of doing that, but you live and you learn. And that was him right after the dentures were delivered. And so you can see just what a difference it makes. This lady, this is just her in temporaries on the right, but I ended up finishing her case, but she was a cancer survivor, really wanted to take care of herself and do something for herself for once. And she decided to invest in her smile, and still to this day, still get text messages about how much she loves her teeth. So just like I said, absolutely wonderful that dentistry holds so many different things of, not only are you helping someone's health, but you're also helping their mental health. And it's just great to build these types of relationships with patients where, like I said, I graduated 3 years ago now almost, actually a couple weeks, it's going to be 3 years. And I'm still talking to these people to this day and seeing, what an impact I've made. Some other really cool things with dentistry, working on animals. So this was an article that the Florida Dental Association asked me to write about my experience. I had met, his name is Dr. William Geyer, and actually it was a Saturday night or Saturday morning, and I became president of ASDA, and not that same day, but just earlier. But I was watching TV, and there was a show called the Wildlife Docs. And when I knew that, like, I was trying to figure out something cool to like have for my first meeting of ASDA, for the chapter, and I'm watching this wildlife docs thing, and I see um, this guy, Dr. William Geyer, come up, and it said that uh, oh well, okay, yeah, back up. So they were showing different animals, and they were like, yeah, sometimes we bring in like doctors for humans to like help fix the animals for certain situations. And we have this gorilla that needed whatever he needed of filling, and so we brought in a dentist, and then they show Dr. Geyer, and I was like, oh my god, like if it's the thing was being filmed at Busch Gardens, so I'm like, okay, well, Busch Gardens is in Tampa, and this guy has to be somewhere around here. So being a creeper, I went online and I researched him, and I found out, that he lives and works close to Tampa, and I hit him up and I was like, hey, like I'd love to have you come and speak. And he came and he spoke, and he actually ended up coming to my graduation. Like when we he's just an amazing person. And he asked me, he's like, hey, would you like to come to Busch Gardens and help me one day? And I was like, well, duh. And so that was this experience. So you can see Lana, the lesser bush baby. She had generalized chronic severe periodontitis. So basically, she needed deep cleanings every 3 months. And so he would come in and give her these deep cleanings. And she's just the cutest little thing. You can see just how small she is. And actually, he did some research, and that it's actually a big thing, a very common thing with these lesser bush babies, that they have this periodontitis. And then while we were there, Mikey, the red kangaroo, he came in because he was getting he tended to be a more social kangaroo, and he wasn't really doing what he usually did, interacting with the other kangaroos and whatnot, and not eating very well. And so they brought him in to like kind of do an exam. And then since we were there, they're like, hey, can you check his mouth to make sure like nothing's wrong with one of his teeth, maybe that's why he's not eating or whatever. So that's how Mikey and I got to hang out. So I was so scared. I'm like, if that thing wakes up, like we're all screwed. Like because that tail and those legs that he had were gonna, whew, yeah. So I might be 6'3", but that thing was gonna jump a lot higher than me. So very cool opportunity. And again, like just see how many cool things there are that you can do as a dentist. So I have a couple of implant cases that I wanted to show you. This is just something that you can do. Like a lot of offices are getting this now, of a digital scanner, so you don't have to take impressions anymore using your alginate, and you can just scan someone's mouth. This is my mouth. I have a big mouth, and you can just scan it, and now you don't have someone gagging all the time and blah blah blah, and you can do pretty much all of your work based off that. And they can take, the labs can take the scan and then print out a 3D model and go from there. So super cool. So this was in my fellowship, where I'm going to show you how you can apply the digital scanning to an implant. So here, this is called, on the left, it's something called a scan body. And so basically it is helping you take an impression of the implant that's placed in the gum, and and then that way the lab can capture the way that the tissue looks, and then they can end up building the crown off of it. So with this lady, this is what happened with her. Number 30, so your lower right quadrant, first molar was the tooth that was affected, and She had a very foul odor coming out of her mouth, really big infection. You can see that darkness over here. And the tooth was mobile. The tooth was fractured between the roots. I mean, every little thing was wrong with it. You will see a lot of issues when you become dentist with first molars. So your first molars, they come out when you're about 6 years old. And so if you think about it, the only other teeth that come out when you're 6 are your lower front teeth. And so your lower front teeth and your molars are the teeth that are in the longest amount of time in your mouth. So a lot of people have a lot of work done to those first molars, and they're the most common site for dental implants. Okay, so just your fun fact for the day. Not a quiz question. Should have been though. But yeah. So with her, we took out that tooth. Okay, yeah. Took out that tooth, placed a really big implant in there, cleaned it all up like no other, placed a big implant in there. And then took that digital impression. You can see the scan body over here. And then this was just on the right side. It was just something that went over the implant to let it heal, but still keep the tissue away from it so you can access the implant. And then she had a crown placed in there. So this is what that implant looked like after it was placed, and that infection all took care of itself over there. I know you guys can't speak to me, but anything look a little fishy with this picture? I'll give it a 10 seconds.
Yeah, I was gonna say the screw because it looks like that was too sweet.
Yep. So someone had 2 implants, one right on top of the other one. So this patient came into my practice here, and I like see the x-ray and I'm like, oh my God, like that's just bad, like bad. And I asked the patient, and I was like, anything look funny over here? She's like, no, she's like, I've never been told, like nobody ever told me that the implant went wrong or anything like that. And I was like, oh my God. I'm like, do you have feeling? Because I'm like, did this implant like hit her nerve or like what? And she's like, no, everything's fine. And she has that. I mean, there's a lot of mistakes over here. Actually, I actually didn't notice that until now, but because I think I was just so focused in on those 2 implants. So that's actually a big no-no. So if you see, she has a bridge, okay. But that bridge, this tooth is a regular tooth, which is actually root canal treated, which makes it more brittle. So that's going to break on her at some point. And then this is your implant. Okay. So an implant does not have a periodontal ligament. So it's not flexible. It's just rigid in your bone, as opposed to your natural teeth. Anytime that you bite down, there's a little bit of flexing. Okay. So they flex, your teeth do, because of this periodontal ligament. And so you never put a bridge. Maybe some people will disagree with me, but I could promise you 97 probably % of dentists will not disagree with me. You never connect, make a bridge connecting a tooth with an implant, okay? A natural tooth with an implant, because one is flexing, the other one's rigid, something's going to break, okay? So here, what I'm assuming happened is whoever placed this implant, which thank God she's okay with, but whoever placed this implant probably forgot to change the settings, because you're supposed to change the settings to something super slow, like super slow when you start placing that implant in. So, but when you're making your osteotomy to fit the implant, you go at a high speed. So I'm assuming that they forgot to change it from that high speed to that low one when they went to place the implant. Implant went foomp down into the jaw, and then the surgeon had a oh shit moment and said, okay, well, what do I do now? And somehow put another implant in there. So she had absolutely no clue. And I will, it's just like, okay, well, now what? But just monitor it. Okay. This was a case that I did a couple months ago. We're getting ready to restore her right now, but let me look at how I am on timing. Okay, I'm almost done. So she just needed a 2 implant overdenture. So you can see how we started, then make the incision to expose everything, and then you use a guide, which you see over here in this picture. So you use a guide that I designed. Actually, right before I started this, I was on the phone with the lab planning a guide for somebody else. So this will tell me exactly where I want to place those implants because I placed them all digitally beforehand. And then I make these, I make your osteotomies and make sure those implants are parallel as they can be, and then cover them up, suture her over. And then she's coming in soon for us to open up that and expose those 2 implants again. And now that they're all healed and integrated into the bone, and now we can hook them up to her denture. So it'll be awesome for her. So this is the last case that I'm going to show you. This is called Chrome. It's full arch guided stability. So basically you plan absolutely everything from A to Z digitally, and you have a bunch of guides that are going to help you do what you want to do to place a bunch of implants. So this patient came in with the best tooth complaint I've heard of until now. I want to be able to chew a pork chop because now I can only chew a filet mignon. Struggle is real. And so she wanted her uppers taken care of. All the uppers needed to come out. Something was wrong with each one of them, and she was just over it. And she wanted to keep her lowers, but like I said, change the uppers and make a hybrid. Okay, so a hybrid denture, you'll see a little bit later on, but basically you need 4 to 6, if not even more, implants. And that hooks onto the hybrid, and the hybrid is something that cannot come out of your mouth. So it's not a removable denture. The only person that can take it out of your mouth is a dentist. So here you can see on the bottom what all of those looked like after they were placed. This was how, this is just the setup of the day. You can see all the guides over here in the middle, all the little pieces that we needed, the implants, bunch of fun stuff. This is the way that I set up the room. So I just put a bunch of stuff everywhere in the room. So just to keep myself organized, and I knew which implant needed to go where. This was after the case was already done. But me being my little OCD self. So here we go. Here's some, hopefully no one's eating. Okay. So this was, so you can recognize those teeth now, right? We laid a buccal flap. So meaning kind of went everywhere and anywhere around those teeth to move her tissue and just flap everything up. Okay. Then we needed to make this pin guide. Okay. So you see this metal over here. Okay. So you place that, so that metal goes above, and then you place this pin guide over the teeth. So you know exactly where that metal bar is going to sit, and you'll see why. And you'll see these blue things that they're very, 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 very skinny. They're not screws, but nails, I guess you'd say, that you just kind of hammer into the bone. Okay. And that's going to help hold that guide where it is. Okay. And then every time that you take off this thing over here, you attach it through these little areas here. So now I took off that, and you see my bar, which is my fixation base, and is also where I have to cut the bone to, because you have to have a certain amount of space to fit in all of the parts that are going to attach the implants to the dentures. Okay, so you can see that is quite a bit of bone that needs to be taken away once those teeth are out. So next step is to take out all of the teeth, then mow all of this down. Just pretty crazy. So now all of that is mowed down nice and flat, and you put your osteotomy guide. So osteotomy basically just means the hole that you're going to create in the bone to place the implant. Okay, so each implant, so 1, 2, 3, 4, 5, 6 in the back, goes through these holes. Okay, so here the implants were placed, and then these are not the implants. These are some abutments, which are what you're going to seat your temporary hybrid onto. And you put these little blockouts over there so that your material doesn't get everywhere. And now this is what that temporary hybrid looks like. And you have to make sure you position it so that this midline goes with her face and her nose, and you make all those measurements before you start so that you know, okay, I'm not off to the side somewhere. And each one of these holes gets filled with the material that you need, okay, the pickup material. So now everything came off and we sutured everything up. And then now we screwed it all in by hand, okay? So when there's a lot of things you're gonna learn if you go into doing this stuff, but with a hybrid, it's not for every patient. You have to make sure you can keep it clean all up in here. You have to make sure a patient doesn't have a very high smile line, because if they do have a high smile line, they're gonna catch their lip on that top over there. And that's not going to be pretty. And also, if they do have a high smile line and you see that transition, that's another uh-oh moment, because nobody wants to see that, okay? Not even the patient. So I ended up taking this tooth out. She was too tired that day, so I took it out later and then made her a partial that went in the back. And again, this was all temporary. This was immediately after delivery, so she was really numb, as you can see. And this was 1 week after delivery. And then this is with the partial in, okay? Again, still temporary. I think she's almost done now with getting the final one in, but I'm not in the fellowship anymore. So I never got to see that part. But to finish up, remember the outcome of following your dreams. You can have a really big certificate like mine, and then maybe do a master's too and have a little smaller one in the other hand. And just know, everything that you go through, everything happens for a reason at the time that it's supposed to. If you don't get into dental school when you think you're supposed to get into dental school, it's okay. There's a reason for it. You'll find out. Don't worry about it, okay? And always surround yourself with people who are better than you, because they're always going to want to see you grow. They're always going to want to push you to be the best person that you can be. So find a David Rice in your life, and find those people that are going to make you be the best person that you can be. If you guys ever need anything, that's my email address. There's my Facebook. And there's my Instagram. I think you guys tagged me in the post for the advertisement, so you guys could find me easily on Instagram through that also. But I'm always here. I'm a quick call or text away. Might be a little hard to get back to you, but sometimes I have like I said, I have a longer drive home, so it's a good time for me to talk to people and help you all out. But thank you so much for your time. Finished at 4:59. Yay me. But hopefully you guys have some questions that I can answer. But thank you again for spending this time together.
Thank you, Dr. Sable, for that wonderful presentation. Also,
you're welcome.
The words of inspiration. I know those are like amazing for students right now that are pre-dental, and especially with exam season. So thank you so much for that. So we do have a couple questions kind of just from your presentation we've gotten from Instagram and YouTube. So I'll just get started. So the first question is, with that case that you were discussing where you kind of got the wisdom tooth out with it, but you thought it was something else, like God forbid if it was the bad scenario, what would you do in that case? So what would be the next steps in like an emergency or a situation like that?
It's a great question. I probably would have corresponded with an oral surgeon to see exactly what the best choice would be, but usually, you have to look at how big it is, and if it's not tremendously big, if you don't have a communication with the sinus, then you're pretty safe just suturing over it. In this situation, the patient was 80 at the time. So it's like, I don't think he had enough teeth where I don't think he's actually going to go into, needing a denture and stuff like that. And so you could technically put like a bone graft up in there, stuff like that. But it's not like that place was going to be an area for an implant at any time. And so you just kind of suture it and just keep an eye on it as long as there's no communication with the sinus. If there is communication with the sinus, you have to do a couple more things of, putting in a collagen plug possibly, or possibly just sending them to the oral surgeon and saying, hey, this is what happened and please fix it with your magical ways.
Awesome, thank you. So I also have some questions about residency. So you had described the difference between like the two programs, but specifically for the one that you did, what would like a day in your life look like? Is there a lot of like, is it research based, or is it just a lot of like patient care, or kind of maybe like a day in your life with residency kind of?
Basically just patient care. I mean, it was basically like just going to work, except you had a little more time. And you had to go through all the, trials and tribulations of still being in a school. But it's nice because you still have the backup of like having dentists with you to tell you, kind of guide you into what's best. And when you're in the residency, it's not that you're seeing like just your regular and, everyday patients. You're seeing bigger, more complex cases, whether they're medically compromised, whether they're dentally compromised. And so you're doing like full mouth rehabs, like people with severely worn dentition, trying to like build everything back up, trying to figure out how they need to occlude properly. Just a lot of things that the regular dental students couldn't do because it was too advanced for them.
Awesome, thank you. So the next question just kind of has to do with the challenges and like rewarding parts about your profession. What would you say like probably like the more challenging parts, but then at the end of the day, there's also the rewarding parts of being a dentist for you?
It's actually the same answer, I would say. People, the patients, they can be very challenging. It's hard to, especially when you're like running between rooms and you have to do a hygiene check and then you have two other patients in the chair. People get restless, stuff doesn't go the right way, and you have to sit and explain it to the patient, and you have to still gain their trust and keep their trust rather, in you, and say, and just, be honest with yourself and be honest with your patients, and that not everything is rainbows and unicorns, and you're going to come across some people that are not the easiest to deal with, and they'll get frustrated with you, and you're just like, I'm sorry, but I also am a human, and I'm not perfect. But then you have your rewarding times where you have these patients that you change their lives and they just cannot love you more. And so, and when you hear the like, oh my God, like I've been afraid of the dentist for so many years, and like you've given me the courage to come back and take care of my teeth, it's a great feeling. So
Awesome, thank you. So for like a lot of times for patients and just people in general, going to the dentist can be scary. So for somebody that has like dentist anxiety or just doesn't like the whole idea of getting anything done with their teeth, how would you deal with that? Like to calm them down or to just kind of go from there if they are anxious?
it's a great question. So it really depends on you as a person, but like I'm a very sarcastic jokester type of person. So like when I hear someone, like I'll have patients that'll just full on tell me like I hate the dentist. And I'm like, oh, that's okay. Like I've learned not to take it personally anymore. And then like they'll be like, oh my God, I'm so scared to get the shot. And I'll just be like, it's okay. Like, just close your eyes. I'll close mine too. Like, everything's going to be fine. And, you just like kind of do these, I come up with them on the fly, and where I add in some humor, and it just really like calms that person down, and they're just like, oh, okay. Little things that like I've caught on from other people is like how I like speak to the patient in regards to like if I'm doing an injection, I'll start to talk really slow as I'm administering that anesthetic, and then it just calms them down and they're like, oh, it's over. And I'm like, I'm 50% there, like we're almost done, and they're like, oh, okay. And so I do little things like that. And I'll just keep saying like breathe through your nose, wiggle your toes, and I sing a lot to the patient. And so far nobody's complained, so that's good. But yeah, like you're gonna have to find your little tricks that you're comfortable doing, because not everyone's has that type of humor that I do, and not every patient will respond to that either. So you really have to pick and choose. There's something that Dr. Rice talks about, which is called DISC, to do a DISC assessment, where you kind of assess what type of patient that they are as a personality. Are they more I forgot what everything stands for, dominant, capital, or sorry. But where you can tell, like, is it someone who wants to get in and out of there quickly and doesn't want you to explain stuff to them, or someone, like, usually if someone's an engineer by profession, like they're going to want to know every little thing about the materials. So you have to learn how to like read people to see like how you're going to talk to them to do something. And your assistants are really helpful with that too, because they tend to get like the first read on the patient, and they'll tell you like what to expect.
Awesome, thank you. That sounds wonderful. Everything that you said. Let's see. So next question kind of has to do with patient care from like dental school to like residency to like real life practice. Like, how do you think just like the interactions, the work that you did, and just kind of the way everything was set up changed through those 3 phases? If that makes sense.
Um, like how that's all changed over time,
Yeah.
or
Yeah.
okay.
So, like
I
with patient
mean,
care.
like, let's see. Hopefully I'm answering this correctly. But I mean, like in dental school, everything was a lot simpler. I would say dental school, don't think that you're like the bomb.com when you get out of dental school. You just barely scratch the surface, and you have so much more to learn. So when I see people, that are just like, nope, I got this, we're good, I'm like, ha. Because like me, I specifically went into my residency and my fellowship so I could get better at a younger age. But like I look at my associate, who he just graduated a year before me, but he didn't do a residency or anything like that after. And like he has a lot more real world experience than I do. And so like I've seen that I kind of think a little bit too far, because I'm like, oh my God, if they lose this one tooth, then what about this? And what about that? What about this? And I think very like long term, as opposed to like when you're, depending on the type of practice that you're in, but you have to be more quick on your feet and like thinking of how you're going to treat that patient and give them what they need. And so he's very good at like helping me out with coaching me on like, just take a chill pill, Sable, and like, address this like one tooth at a time. Don't overwhelm yourself so much, because the patient gets overwhelmed too. So I would say, it's kind of also like LECOM, I did a lot compared to other dental students, a lot, dental schools rather. I got a lot of clinical time, which I really appreciated. But you think you're great, and then like even now, like sometimes I'll take an X-ray, I'll see X-rays of what I did 6 months ago, and I'm like, oops, like I'm like, okay, I might want to redo that one. And like tell the patient like, hey, I didn't do the greatest job right then. And you have to know, like, recognize where your faults are and just be like, no, this didn't turn out great, I need to redo this. And so you get humbled, I would say, the further you go, and you're just like, wow, I'm not that great. But I am great at certain things, not great at other things, but I'm learning how to be better.
Awesome, thank you. Let's see. I had a question, kind of forgot. But let's see. I was gonna just ask more about like your favorite procedure and like maybe the tools that you use because I know a lot of since they can't shadow in person, they are curious about like different tools that you might use.
Okay. Let's see. I'm like looking in the office right now. I mean, I will say like my favorite thing to do is probably an extraction or a placement of an implant, though the implant placement sometimes can get stressful when you're like going in between teeth. Because you're like, well, can't, I don't want to like touch another tooth because then oops. That's not a good thing. So I don't know, I'd probably say extractions are my favorite things to do. I would say my favorite instrument when it comes to extracting is something called a spade elevator. So actually, this is a good question because I can answer this a good way. So some tips and tricks. So some of this is stuff that my dad taught me also, but when you start an extraction, you're going to want to use something called a periosteal elevator. And it's something that's usually really thin and it goes around the tooth to separate the periodontal ligament from the tooth. Okay. There's these things called Sharpie's fibers that, that are part of the whole system that holds the gum and the bone to the tooth. Okay. So you have your tooth and you want to take this Sharpie fiber around kind of like you would a perio probe and take it around the tooth to separate these. Did I say Sharpie's fibers too many times? I might have. To separate the Sharpie's fibers from the tooth. And this also kind of like, it works in two ways. One of the ways is it like kind of prepares the tooth. I'm pretending the tooth has a brain, but it's just like, oh, okay, something's going on here that wants me to like loosen up away from this area. So that's one thing. And then also like as a patient, you're checking out, like, okay, are they really numb? Because that's when you can tell well if they're numb. Okay. Now, your next step is to use an elevator. So an elevator, I don't have any right here, but anyways, so with your elevators, there's different sizes to them and there's different looks to them and angles and whatnot. My favorite thing to start with is something called a spade elevator, which looks like a spade from like a card. And so it's pointy and it lets me also kind of dig into the tooth. And what happens is you need to find what's called a purchase point, which is like a space where you can get some anchorage into that tooth so that you can get that tooth to loosen up away from the bone. So that purchase point might be where there's bone, or it might be where you have another tooth to, like I said, push against. Okay. So my advice to anyone is get that tooth as loose as humanly possible before you take a forceps to it. Okay. And the way to get it loose is by getting these elevators. And so the elevators, they get bigger. And so I always go through all of the elevators so I can get as loose as I possibly can before I take that forceps and I pull the tooth out. Because if you take that forceps and pull the tooth out too quickly, you're very likely to grab bone, break off something, and it becomes a lot more traumatic for the patient to heal later. And then also, it could just provide for a not a fun healing site.
Awesome, thank you. Okay, so I think that's all the questions we have for today. Thank you so much, Dr. Sable, for the wonderful presentation.
You're welcome.
Q&A session, also just like the words of inspiration. Like I really personally appreciate that a lot. So thank you so much. And yeah.
You're very welcome. And like I said, if anyone has any questions, feel free to reach out. And I hope everyone enjoyed watching. And